Welcome, everyone. Thank you for joining us today on our Target BP Evolution webinar. We are delighted to provide a preview of our upcoming attestation criteria and an opportunity for public comment. I'm Allison Smith. I'm the Program Director for Target BP. I work on behalf of the American Heart Association and the American Medical Association, and we're just grateful that you're here with us today. I'm joined today by my colleague, Liz Montgomery, and I will turn it to Liz to get us started today.
Thank you, Allison. I echo my thanks for everyone joining us today. We're so excited to be able to share this new information with you. I am Liz Montgomery. I am a data analyst on the outpatient health IT team for the American Heart Association. And I also want to let you know that you may be receiving comments from my colleague, Rebecca Alicki. She is helping us to manage the Q&A and chat sections today. So welcome, and let's go ahead and get started. Just very quickly, we are running the accessibility features for closed captioning. So you have the ability to manage these settings independently at the bottom of your screen. Just look for that closed captioning button. You can either pop this out and have a running transcript on the side, or you can change the size, even turn it off if you're finding it is in the way. And we have a lot of content to cover today, so we won't be having a separate time to do a full Q&A with participants coming off mute at the end of the session. But if you do have questions, please utilize the Q&A function, and we will answer them at brief pauses throughout the event, verbally and/or via the Q&A box section. Also, the chat function is a great way to interact, share your comments and thoughts. So please keep a look out there for resource links that will be dropped throughout the presentation. And I do want to let you know that both the recording and slides will be made available after the event at Target BP. During our call today, we'll start by providing some context on Target BP and how the overall initiative has grown during its lifetime. We're going to be introducing how Target BP is going to continue to evolve by introducing new evidence-based activities, giving you a clear timeline for what that means for your data submissions, a walkthrough of those new activities, and then finally, we'll be promoting how you can provide feedback on the evolution through a survey. So to get us started, Allison, I was wondering, do you want to speak to some of the history of Target BP?
Sure, just really briefly, I want to acknowledge, Target BP was launched back in 2017, just prior to the release of the AHA-ACC hypertension guideline. And at that time, the website was launched, the recognition program in an earlier form was launched, and many quality improvement tools and resources were made available. And over the last almost 7 years now, we have, based on that foundation of the AMA MAP-BP framework and the recognition program, our community has grown, but also the tools and resources and work of the AHA and the AMA has grown, both at the national level, working on, for example, policy issues at the federal level and at the state level, but also at the local and regional level through the partnership with AHA's Community Impact Team. And we've had a proliferation of educational tools, professional resources, and some regional and local summits, in addition to a public awareness campaign that's been refreshed on several occasions in collaboration with the Ad Council. So we've certainly seen a significant expansion over the course of time. So Liz, back to you.
Thanks. And this slide, I think, will just really echo your point about the growth of the program. When we first began the annual recognition program in 2017, we had just 330 organizations joining us, and we offered 2 award levels for those who completed the full data submission, including measure details from MITS 236, controlling high blood pressure. So this included the Gold Award for those with blood pressure control rates of equal to or greater than 70%, and participant for organizations who could not meet that 70% threshold, but were still committed to improving blood pressure practices. Beginning in 2021, we expanded the award criteria to the Silver and Gold Plus awards, And the criteria to earn either of these awards includes attesting to the completion of 4 of 6 evidence-based blood pressure measurement activities to support accurate blood pressure measurement for every patient every time. So we recognize that for some organizations, the gap to the 70% threshold is much larger, harder to reach, sometimes harder to sustain than for other organizations. And these awards were created in part to give realistic goals that should help organizations make progress towards higher control rates, while recognizing the work that goes into putting these activities into practice. I also want to point out that part of our ability to make these awards and make these changes is because we have such a strong retention rate. With the last 3 years, over 80% of organizations that join us one year continue to join us the following year. So it's really exciting to hear and learn from organizations as they continue to join us year after year. And this year's results are still in the process of being finalized. We're very close, but the aggregate results here are getting very, very close. So I can quickly share that we're continuing to reach well over 8 million hypertensive patients with the Target BP recognition program. We've also seen a jump in every award category above participant level. That means we're seeing organizations move to silver or gold plus. And this is all to underline a statistic that we have shared on previous Target BP webinars. But if this is your first time joining us, I'd like to share that by the second year of data submission on those blood pressure measurement activities, we saw a 10 to 15% jump in positive attestations. And this year, over 80% of organizations that submitted data achieved either silver or gold plus. And beyond that, nearly half of all organizations achieved every single one of these activities. This has been incredibly exciting for the Target BP team to see, for all of our staff to see, hopefully for organizations to see as well. And remember that these are affecting over 8.5 million hypertensive patients across the US. So looking at this data, this exciting data, the broader Target BP team has been discussing the long-term vision for Target BP. We knew, of course, that any changes would be based on the science and utilizing the existing 2017 hypertension guideline. We knew we wanted to remain consistent with the AMA MAP framework and, of course, with our underlying health equity approach. This is why, as we walk through these new questions that we're going to be sharing, if you've joined us before, you're probably going to feel like, haven't I heard this before? Haven't I seen this before? A lot of the language and a lot of the resources. And the answer is yes. A lot of this is based off of things that we have been sharing since the initial launch of Target BP. What we'll be discussing today will not impact your awards in either 2023 or 2024. We'll go over the timeline in a minute, but just want to let you know up front that the impact on awards will begin in 2025. We evolved the recognition criteria goals based upon the expertise and feedback from the Target BP Advisory Group, the American Heart Association's Outpatient Quality Improvement Advisory Committee, the National AHA and AMA Target BP team, and the AHA's Regional Community Impact team. So lots and lots of feedback, and these at the end here, these are the local staff that are working with you throughout the year and communicating back the conversations they've had with you, the struggles, the successes. So many of the activities are in strong alignment with the ongoing work you are accomplishing together. Our first goal was to place significant emphasis on meeting people where they're at in their quality improvement journey. We're keeping in mind previous responses to our last survey that many of you participated in prior to the expansion to Silver and Gold Plus, and we'll also be opening up a new survey to gain even more perspective firsthand. We're making sure that with whatever changes we make, we're not going to leave anyone behind for recognition. We recognize that Silver can still be a challenge for some organizations, but also that others are eager to tackle the next step in their hypertension quality improvement journey. Our second goal was to encourage organizations to both define care policies, and assess if they're being practiced. This is why we are emphasizing evidence-based and systematic approaches. Finally, we want to give you the full roadmap and create room for growth and incentives for improvement over time. What does the landscape ahead look like? Today, we will be first, of course, sharing everything with you, and we're also going to be opening a survey that will allow you to provide your feedback, which will be carefully considered as we finalize language, resources like FAQs or webinars with CME credit, and determine award impact. This survey will be closed on August 25th. This September 2023 awardees will be announced with no changes to the existing criteria. In January of 2024, when data submission opens, there will be new evidence-based activity questions that will be included in a dry run of sorts. Your answers will be required to complete the form, but they won't impact your award eligibility in any way. After data submission ends, we'll then be carefully reflecting on both the survey results and the attestation data to determine any impact on 2025 awards. This impact will be announced in the summer of 2024. They'll have 6 months to make any final practice changes during that calendar year. And then finally, when data submission opens in 2025, it will continue to include these questions about your practices from the practices you did in 2024, potentially with some language changes for clarity, again, based off of your feedback. This time, they will impact the awards that will be announced in fall 2025. Across the next several years, we'll be sharing existing resources to support your quality improvement efforts and creating new resources in response to the needs identified through the survey. The new evidence-based activities questions will fall underneath 4 categories that will align with the structure of Measure Accurately. They are Act Rapidly, Partner with Patients, SMBP, and Equitable Health Outcomes. We're referring to each category as a pillar of Target BP. Each pillar will include 6 attestation questions underneath that umbrella. So Allison, I'll pause here to see if you want to share any of your thoughts on any of the items shared so far.
Liz, thank you for walking through the rationale, the timing, and really the opportunity to expand this evidence-based pillar activity to help to provide a long-term roadmap for quality improvement in a way that's consistent with the AMA MAP framework, as you discussed. And so I think all of these realms of acting rapidly, because we know treatment intensification has such a great impact on blood pressure control, the importance of partnering with patients on lifestyle modification, the evolving and rapid uptake and use of self-measured blood pressure, and the ever important quest to achieve equitable health outcomes, I think are all we tried to represent all of those things in the details that we'll dive into in a bit. Back to you, Liz.
Great, thank you. Thanks for that insight. Let's start with what is currently included in the Target BP program form. If you are an organization who has joined us the last few years, these are going to be very familiar to you. Our Measure Accurately pillar includes questions on calibrating devices, checking device validation, training and testing teams in blood pressure measurement, adopting a protocol for repeat measurement, and posting an infographic where blood pressure is measured. And our Target B website includes many, many tools and resources to help organizations measure accurately. So this includes a quick start guide, several versions of a blood pressure measurement infographic, and like I said, many more. So we will kind of repeat this throughout some of the existing resources that we have, but just to give you an idea of the existing framework. Moving on, we'd like to pause before digging into the new activities and see what extent did including the Measure Accurately evidence-based activities and resources influence your quality improvement priorities. You can select from not at all to very much. All right, seeing a lot come in. It looks like the majority are tied between very much and somewhat. So this is very exciting to see. All right, it looks like we're slowing down. Maybe give it just another 10 seconds or so.
Appreciate the feedback. All right.
Okay, I think we can probably go ahead and close out the poll. We have about 42% of our audience having participated. We'll go ahead and share the results. So you can see that we do have about 70% who are unsure. Maybe you're joining us for the first time or you're still new to your organization. But either way, very exciting to see that there has been an impact and what that might mean moving forward. Allison, I'll pass over to you here.
Thanks so much, Liz. I appreciate that and everyone's participation. As a quick reminder, we invite you to put any of your questions in the Q&A at any point in time, and our team will do their best to either type responses, answer them live, or include answers in our follow-up correspondence from this event that is recorded, and we'll be sharing that shortly as well. So let's dive in here. What will be included in the Act Rapidly pillar? So similar to the Measure Accurately attestation questions, there will be 6, and you'll see a pattern as we go through each of the pillars today, that there'll be a policy element, a practice assessment element, and then the remaining elements related to the substance of that pillar, the evidence-based, strongly supported evidence of that pillar. So for Act Rapidly, the policy element focuses on adoption of a treatment algorithm, and the practice assessment looks at whether or not that treatment algorithm is being followed. Realizing that algorithms are a guideline, there are always patient exceptions, but to what extent, are we looking to see if our team is using it to guide care? And then the practice elements highlight aspects of treatment goals, the intensification of treatment if patient isn't yet at control, strategies to improve medication adherence, and the importance of follow-up. So I'll get into those in a little bit more detail here. So this is just the high-level overview. The actual attestation questions end up, and my slides are being a little slow here. There we go. The actual attestation questions that you will see in the dry run. Sorry, we advanced one too far here. Maybe Liz, you can help me get back on the right page here. Thank you. The attestation questions will ask if you are using a practice-wide hypertension treatment protocol that would include at a minimum, firstly, a formal and systematic adoption. And by that, we mean that it is used throughout the entity that is attesting. So if one provider in a clinic, in a health system who's attesting to it is using it, I would not consider that systematic adoption as an example. So we would want to see something systematically adopted throughout the entity that is submitting data and attesting to that practice. Then next, thinking about monitoring, are we using the protocol? It's one thing to have it sitting on the shelf and it's another to be actually impacting care in some way. And there's a lot of latitude for how that could be incorporated into practice, also in how it can be monitored. There's good old-fashioned chart review and sampling. There are also more sophisticated methods for monitoring that could leverage your population health tools or your electronic health record tools. Every organization has a different way that it examines quality improvement data, and we want to offer that, certainly that latitude to you, but some meaningful way of looking at whether or not a protocol is being used in practice. And then we get into the substance of that algorithm. Does it state that blood pressure a treatment goal of less than 130/80 for adults with confirmed hypertension and known cardiovascular disease, or a 10-year ASCVD event risk of 10% or higher is stated? This is in accordance directly with the 2017 AHA-ACC hypertension guideline. We would also want to see that algorithm would include prompts to providers to intensify treatment, ideally with additional medication classes or increased doses for patients who are not yet in control with their hypertension. We'd also want to see that there are strategies to promote medication adherence, such as using single pill combination therapies where 2 or more medications can be combined into a single tablet, or other strategies that minimize and simplify medication regimens. And then lastly, we'd want to see that follow-up for a patient who is not yet at their goal, who has stage 1 or 2 hypertension, would be within a month's period of time, and that specified in an algorithm. So the answers to each of these attestation questions, just like the ones for Measure Accurately, would be yes, no, or unsure. You would have to choose one of those to complete the attestation. So that is a very similar approach. In support of these, what we've created is a summary of the science from the guideline that supports each of these attestation questions. And a short version of that is displayed here. So the actual recommendation from the guideline 12.4.2 and so on are described that really support the use of systematic approaches, the use of regular quality improvement activities to examine practice patterns, and then these specific content elements around treatment goals, the role of medication class use and dosing, and single pill combination therapies, as well as the importance of prompt follow-up, are all outlined in some supporting documents that will be available to you momentarily. Similarly, we also have resources to help your organization work on aspects of these attestation questions. So starting with the Act Rapidly Quick Start Guide, there's a pre-assessment to look at your practice. There are educational programs on demand, CME, CE activities, as well as other practice tools and resources to help you achieve these if these are not already in place in your organization. So with that, I want to go back to sort of the simplified version of the Act Rapidly criteria pillar and see if there are any questions, Liz, that have come in from our audience so far.
Hi, Allison. Yes, so there were a couple. One I think we're going to cover towards the end of the deck, so I'll wait on that. And I saw you did answer it live, but we also received a question asking, so this is looking at a controlled blood pressure, not under 140/90, which is how we ask our measure questions, but instead under 130. Can you speak to that a little bit?
Yeah, thanks for that question. I think there continues to be some confusion over that. The measure, the NQF 18 or CMS measure that we use for the purpose of recognition is a standard that is a reporting requirement for UDS, for CMS, for other quality programs. And that's the one that we have adopted in Target BP for the purpose of the ease of data submission and to be consistent with that. We recognize that when the 2017 guidelines came out, that the treatment goal was lowered. And so we look at the performance measure that is submitted is just that, a performance measure, not a treatment goal for specific patients. And so we would want an algorithm that would be used in the context of a specific patient to look at a treatment goal of less than 130/80. And we can provide some additional FAQs on that. So I really appreciate that question.
Thanks, Allison. No other questions on this.
Thanks. So we're going to move on to the next pillar. So partner with patients. And this is all about lifestyle modification and the ways in which we assess and address those opportunities to reduce blood pressure and risk of hypertension. And so just like the last set of attestation questions in pillar, there's a policy element, a practice element, and some substance that goes along with it. So the first attestation question addresses whether or not you have a policy in place to address modifiable lifestyle risk factors. The second is a question about assessing your team's adherence to that standard of care. And then the others address whether we assess issues of nutrition, physical activity, weight, et cetera, and then intervene in some way to address them. Similarly, questions around alcohol and tobacco use assessment and intervention. So that's sort of the high level overview of this pillar. If we dig into the actual attestation questions, you'll see some patterns here. So this might feel a bit repetitive, but does your organization have a systematic approach to assess risk factors and non-pharmacological interventions for patients with hypertension to promote lifestyle change? So again, starting with the policy and procedure around the assessment and intervention of those, monitoring to see if that policy and standard of care is actually in practice by your team. Thirdly, is there a process in place to assess nutrition, sodium and potassium intake, physical activity, weight, and body mass index, which are specifically called out in the guideline as having a direct impact on blood pressure. Also, the assessment of alcohol and tobacco use. And then the sort of pairs with each of those are, is there a process in place to intervene? And that is broadly defined, again, to improve nutrition, reduce sodium intake, increase potassium intake, increase physical activity, reduce weight, or reduce body mass index based on that patient's risk factors. And that could be done through education, counseling, referral to other services. There are a whole number of things that could be considered an intervention in this space. And then similarly with alcohol and tobacco, thinking about strategies for moderation and cessation as the case may be. So again, a similar pattern here where you would be asked yes, no, or unsure in the dry run year, and then eventually in 2025 relating to your recognition status. So lots of runway here. Again, we've outlined the scientific rationale behind these and the specific guideline recommendations that tie to each of these. And again, my slide is being very slow and advancing. So those are there in short form, but also available for you to sort of dig into more deeply in the guideline itself. And then we've also provided the existing tools and resources that will help you assess your practice using the Partner with Patients Quick Start Guide, an assessment, a pre-assessment, some educational programs with on-demand CME and CE, and additional patient education and practice tools like the ones illustrated here. Some of these are probably quite familiar to some, but perhaps not all. All right, back to sort of a overview slide of our Partner with Patients pillar. I don't know if we have some questions coming in here that we want to pause on.
Thanks, Allison. We've had a few questions come in, largely on the Act Rapidly pillar. So what I'd like to share to everyone is at the after we walk through all of the different pillars, we'll pause for a minute and try and address some of the questions and answers that have come in on previous pillars. But if we're not able to get to all of the questions live on the call, we will include the answers in a follow-up email that will go to all attendees. So just in case you don't hear from us during the call, know that that is coming. One question that we had on partnering with patients was, can organizations share policies that they use that address modifiable lifestyle risk factors? I think we've got kind of a model sharing for policies around lifestyle.
That is a great suggestion. And I think as we go through particularly this fall and into next year, I think one of the things that we will be leveraging our newsletter for is sharing feedback from you all and additional resources based on the opportunities that you identify. And I think the example of model sharing for organizations who are willing to do so is a terrific one. And in the survey that hopefully you will all respond to, we'll be asking a lot of specific questions. What help do you need on this particular pillar? What questions do you have to be successful? And there's also a very specific question about your willingness to share best practices. And so if your organization is willing to do that, we'd be happy to not reinvent the wheel. And I think it's also an opportunity for us to create additional resources and templates that may be helpful to fill a void that you help identify for us. So thanks for that question.
Thanks, Allison.
All right. we'll press on and hopefully have some more time at the end to address some other questions. So the next pillar is self-measured blood pressure. Certainly something that many of you have spent a lot of time on, particularly getting very good at very quickly during the pandemic. So it's an opportunity to recognize those best practices. In this pillar, we start with, again, a policy element to see that you have a policy that helps define how we prepare patients to successfully perform self-measured blood pressure. And second, there's an assessment component to see if we're actually adhering to the standard of care that we've defined systematically. The content elements really speak to the practice of training patients, both in the measurement technique and the use of the device, establishing a measurement schedule, relaying those readings back to inform treatment and diagnostic decisions, and using SMBP with a critical mass of our patient population, not just sort of a one-off, but are we using it with the critical volume of our patients? And I'll go into a little bit more detail on the next slide as we dive into the actual attestation questions. So again, wanting to attest that your organization utilizes self-measured blood pressure for the evidence-based purposes of confirming a diagnosis, guiding treatment intensification, or supporting long-term lifestyle change and medication adherence for the control of hypertension. And at a minimum, that policy would, that program would include a policy that defines the steps to prepare a patient for success. Assessment, again, could be good old-fashioned chart review, could be some type of medical record audit using EHR capabilities that you may have to look to see if your policy is being followed. And then the elements of that policy would include making sure that a patient is assessed to use the proper size cuff with their home monitoring device, and they receive education that helps them both position properly to take a blood pressure and go through those steps that we have been obsessing about and measure accurately, but also in the training to use the device properly. Every technology is a little bit different. Some organizations certainly are using ways to relay that information back to the clinic through maybe a more elegant RPM system or some Bluetooth connectivity. So the training, both from a clinical standpoint to take the blood pressure properly, but also to use the technology in the way the patient is invited to do. We also want to make sure we're establishing a measurement schedule with patients. Again, the guidelines recommend ideally 2 times in the morning, 2 times in the evening, times 3 to 7 consecutive days to have that systematic sampling of blood pressure and gathering that data. And then the second to last attestation question asks about the mechanism to receive those readings back from a patient. It could be on a napkin or a scrap of paper. It could be a more elegant, electronic transfer. There are a lot of different ways to get that data back from patients. And we want to leave a lot of latitude, recognizing patient and practice resources range wildly. And so we want to create room for that. So again, getting that information back to inform diagnostic and treatment decisions. The device doesn't control the blood pressure. It's what we do with that information that helps. And then lastly, the minimum requirement would be to provide this service to at least 30 patients or 10% of your patient population with hypertension, whichever a number is larger, to signify that you're doing this in a systematic way. Again, if you were just doing this for a handful of patients, it wouldn't be enough to sort of substantiate achievement of the pillar. So again, back to that summary slide for self-measured blood pressure. I'll just pause here and see if there are any additional, sorry, thank you. I was one ahead of myself. Again, we've outlined the rationale from the guidelines that ties to each of those criteria, and a sampling of just some of the resources that are at your fingertips already to support your evidence-based use of self-measured blood pressure. The Quick Start Guide, again, a self-assessment of your practice, some educational CME, CE on-demand resources, and a lot of patient education materials. These are some of my favorites. The training checklist, which could really be the foundation of a policy in your institution, outlining all the things that your team can do to prepare a patient for success, and some of the tools, both training videos, positioning graphics, recording logs, and more that are available to help achieve those pillars. And then I'll pause again on the summary slide of the 6 attestation questions that relate to self-measured blood pressure. Anything, Liz, that we should address at this stage?
We have not gotten any SMBP questions in just yet, and maybe that speaks to the number of resources we have, or maybe we just need to mull it over a little bit and we'll get a few in a minute, but I think we can go ahead and move on.
Great, thanks so much. And I do see the other questions in the Q&A that we will do our best to get to and answer, that some of them sort of transcend all of the pillars, and others are back a few sections. So thank you for those. Keep them coming. The last pillar I'm particularly excited about, equitable health outcomes. And this is really looking at, it has actually 2 policy elements, looking at systematic collection of both race and ethnicity data, as well as social determinants. 2 really important practices to help understand our patient populations and support them accordingly. There's also a specific element about training care teams to adhere to those policies and be able to carry them out. The skills required to gather race and ethnicity data in a way that is engaging and trust building with patients is important. Also, the skill is to assess social determinants. And oftentimes those are different groups of staff in your care teams. Some maybe our front office staff, others may be clinical team staff. So I think sort of recognizing the differences there. And again, an element around assessing your practice. Are you adhering to the policy and procedures that you've set up to gather that important information? The next 2 are, I think, very unique and also consistent with some of the work that we're seeing done outside of Target BP, for example, by the Joint Commission. This is very similar to the direction, excuse me, that they're heading right now. So we want organizations with this data that they've systematically collected to look at your overall blood pressure control rates annually at least, and then to stratify that data by 2 or more subgroups, ideally, or perhaps using your race ethnicity data or social determinants data to take a look at to see if you're able to achieve equitable outcomes for different groups within the patient population that you serve. And then lastly, examining that data, looking for gaps and taking action to address them. So again, we'll dive in a little bit deeper here on the actual attestation questions. We're wanting to attest that your organization has embraced the collection and use of patient data to assess for equitable health outcomes and blood pressure control specifically. So first, the adoption of a policy that would systematically gather race and ethnicity data, and another that would systematically gather social determinants of health data. There are lots of tools and resources that we'll talk about in a minute that can help provide some templates and guidance for doing that, using validated instruments and recommended techniques. Training your teams for success in this is certainly an important element of this to be successful in building trust and getting complete and accurate data. And then monitoring your team's adherence to that policy is really important. And then digging a little deeper here, the activity of stratifying your control rate data, at least annually, by 2 subgroups who are at risk for inequitable health outcomes. Now, this is going to look different for every organization. The patient population that you serve are going to be different, and why we have given really broad latitude here. It might be racial or ethnic groups. It might be patients who do not have insurance. It might be by zip code or a particular element that is in your social determinants of health assessment. So any or all of those or other factors could be really important to examine to stratify your control rate data and see. And it's often quite illuminating. And then lastly, taking that data and looking to see where there are gaps and taking action to improve and narrow those and eliminate those gaps to achieve health equity. And then lastly, just sort of coming back to our summary slide, I can do a quick pause here. Also to acknowledge the evidence that we've outlined from both from the 2017 AHA-ACC hypertension guidelines with relation to this topic, but also to really a growing foundation, looking back to some of the scientific statements on behalf of the American Heart Association around social determinants, but also work by the Institute of Medicine that has long recommended the systematic collection of race and ethnicity data. There are, again, some examples of the target BP tools that link to many other national resources on best practices, policy and procedure templates, training materials for your care teams, and really a growing list, really a proliferation of educational programs to help organizations think about how to address improving health equity in their organizations. So back to our summary slide here, just pausing here to see, Liz, if there are any specific questions to this pillar, or if we should move to other questions.
So we have a number of questions coming in. They're not specifically on this slide, but we do have a few on resources. So Great. I thought it might make sense if we move forward one slide, and then maybe we can pause there.
Great.
Questions. Listen, I don't know if you want to.
Yeah, my slides are being very slow. I apologize. So
here, I'll bring.
I got it. There we go. Over the course of walking through each of these pillars, we've highlighted many resources, and I had sort of one slide that showed all the hyperlinks to all the resources that will be at your fingertips. So I'm sure that list will grow regularly based on your feedback, your needs, and other opportunities that we've discovered. So that's just a snapshot. You will have all these, they're already on that Target PP website, and they'll all be curated here in this handy list as you start digging in based on your organization's needs. So yeah, so.
I was going to say we have two questions on resources. So I thought it might make sense to pause there. And we had a question, will example algorithms be provided? This was referring to our Act Rapidly pillar. And
that's a great.
If not, should they reach out to the American Heart Association for those example algorithms?
Great, thanks very much for that question. There are actually in the Act Rapidly Quick Start Guide, there are some examples embedded in there and some others listed in this resource listing, both through CDC's Million Hearts program, the Veterans Administration, AMA has a hypertension treatment protocol. And I think this is another area where examples that you're willing to share with us, we could also share with the community through regular newsletters and other curated resources. So thank you for that question.
And then our second resource related question was under the SMBP banner, and it is asking, what about resources for CPT codes and billing? We know several FQHCs that struggled with reimbursement, and so having the capacity to bill for these services and FOBs could be an incentive for adopting SMBP.
Yeah, thanks for that. Sustainability and self-measured blood pressure is a big topic. And I know with the end of the public health emergency, some of the coding and billing opportunities for FQHCs in particular have changed and drawn back a bit. So we do have some guidance on the use of CPT codes related to self-measured blood pressure. And I would also recommend looking at the National Association of Community Health Centers, who have terrific guidance on that. So that's something that we can certainly highlight in follow-up. So thanks for calling out that need.
No other resource questions right now. Thanks.
Great. I do see one other quick question that I'll just say, which is related to treatment goals and the synchronization of the UDS measures or the CMS measures. They're all this sort of this, they use the same specification and what the guidelines say. That is an ongoing national debate that we continue to watch carefully. So we are not the stewards of that national measure. The national NCQA is the lead on that. So we'll certainly listen and learn to see if that evolves and synchronizes. All right. Liz, my slides are not advancing, so I will turn it to you to advance.
No problem. I see the 4 new evidence-based activities pillars right now on my screen, which I think is a great place to maybe pause on a question. So there are going to be 30 attestation questions. Was one of the Q&A questions that came up, and the answer is yes. Altogether, there will be 30. They all fold up into the 5 pillars. Measure accurately is not pictured here, but they are what we consider to be essential parts of each pillar. So I'll just pause. I wanted to mention that while we had this visual on screen.
Yeah. And I think that can seem overwhelming, certainly. And I think what we tried to lay out here was, as Liz said earlier, a roadmap for quality improvement. I mean, it would be our recommendation to sort of assess yourself across these pillars, see where you are making progress and could shore up some areas, and other areas you may need to table until you can tackle at another time. Recognizing organizations don't necessarily have the capacity to take on everything all at once. And a lot of times quality improvement efforts are better served through a focused effort. Hence our reason for providing a long on-ramp to get your arms around these, a long on-ramp to have these factor into any type of recognition opportunity. And a reminder that the answer to all these is always going to be yes, no, or unsure. And so if it's not something you're able to assess, or if you don't know the answer, you can always you can choose to say unsure. So that's always an option. Anything else on this, Liz, before we press forward?
I think in the sake of time, we can press forward, and then if we have a few minutes, we'll pause on the rest of the questions, and anything we don't get to, we will of course reply to via email.
So yeah, and this is just, again, sort of a visual of all of the pillars at a high level, thinking about the opportunity to build on the success that you've achieved and measure accurately, and taking on additional pillars over time, as many as your organization has the will and the capacity and the champions to tackle. Clinical champions and QI champions are really essential to make headway in some of these areas. And we also know organizations who are already doing these things. And so this hopefully is an opportunity in those cases to acknowledge the success and the best practices that you've already adopted. All right. With that, Liz, I'll turn to you, I think, to take us through the last poll and section.
Thank you. So we have one more poll now that we have walked through the pillars, and we'd like to know, where do you anticipate wanting additional support for quality improvement? I think we might be starting to hear that a little bit through the Q&As that are coming up, the questions that are being shared with us. But we'll take a look here. I want to make sure to give everyone enough time to answer, but I'll just preview a little bit that I'm seeing a pretty equal response rate across the 4 pillars so far.
Yeah, you don't know how helpful this feedback is, both in the poll today, but also in the follow-up survey. This really helps us understand where support and resource and programming is needed. It's really helpful.
Yes, we wanted to get this gut check from everyone before sharing the survey, since that will be a little bit more in-depth time consuming. So I'm going to go ahead and end the poll, share these results really quick with you so you can see that pretty equal distribution across pillars, and use that. Let me exit out of the poll here and use that to transition into talking about the survey. As we mentioned before, your feedback continues to be incredibly important to us as we work on developing these resources to support your quality improvement efforts and define any changes to our award levels or criteria. So we did have some questions coming in about like, what do you need to do to achieve a pillar? And by providing us feedback in the survey, you're certainly going to be informing how we take those approaches. So please take the time to complete this, which will be shared in the chat and in a post-event email. It should take roughly 15 to 20 minutes, depending on your familiarity with the questions. And we'll ask questions about your organization so we can see how different types of organizations, FQHCs versus large health systems, respond. It will include opportunities for you to share the value of recognition and the new activities. And the survey also asks questions we've just outlined. We'd like to gauge where your current levels of practice are, where modifications might be suggested, and identify potential gaps in education or resources. We'll also ask a few miscellaneous questions that will help develop other areas of Target BP. And of note, the first 20 organizations who provide helpful feedback for us through completing this survey, letting us know where they're at, they're going to receive a $20 gift card to Amazon. We really appreciate the time and commitment it will take to complete this survey, which will close on August 25th. But absolutely, thank you for your time in doing that. We also want to share a few highlights that will be coming up this fall. This September, we're looking forward to being able to award more organizations than ever before for their efforts in hypertension control. We'll also be hosting a new Measure Accurately webinar on September 21st at 11 a.m. Central. And we'll also be reviewing your responses to the survey and sharing some of those responses in aggregate through our Target BP newsletter, along with related quality improvement resources to help address any gaps that we're finding. And we'll also be creating new professional education and resources, again, following the survey based off of your feedback and where we see that we can step in to help support you in your quality improvement journey. A quick reminder of the timeline ahead, which we've listed out here for your reference in the post-event slides, which will be shared. So in 2023, we're announcing the changes and encouraging your responses via survey. In 2024, we're asking the new questions as part of the data submission process that's looking at your practices from this year. The questions will be required to be answered, but will not affect award. And then in 2025, the data you submit reflecting practices in 2024 will affect your awards. And how that will happen, how they'll affect your awards, will again be announced next summer. And as a next step, we encourage you to review the Target BP Evolution Overview document. It's going to give you clear specifications of the pillar definitions, the scientific rationale for each question, and existing resources to support your quality improvement effort. Then we'll ask you to respond to the survey by August 25th. Both the overview document and the survey link will be shared with you via email and posted online. So with that, that is our last slide. So we do have a couple of minutes remaining if we wanted to try and get some of those Q&A questions answered.
Thanks for that, Liz, and underscoring the importance of your survey feedback to us and guiding the road ahead. Some of the questions that I was able to type a few quick answers to, but I want to kind of reiterate for the broader group's benefit is one clarifying point around blood pressure control rates. The We will continue asking for your blood pressure control rate using the current specifications that use less than 140/90 as the threshold. That is not changing until, for the foreseeable future, until the national measure and specifications might be changed. When we were talking about less than 130/80, that is what we would want to see in a treatment algorithm. So it's really having that as a defined standard or goal of care as it relates to that attestation. So hopefully that it's a little bit confusing, and I think we will reiterate that in some more clear guidance. So I saw that came up a few times. So thank you for calling out the confusion that might create. The other question that I saw raised a few times was, how many of these attestation questions will we need to answer or respond affirmatively to achieve award status? So I appreciate award-oriented mentality. So thank you for your interest in that. Really, the survey, responding to that survey, and then in 2024, when we have a dry run of those attestation questions, your answers will inform how we determine the award thresholds, how many attestation questions that you need to attest to, and how many pillars will constitute what awards. That's we are listening and learning from you and with you as we go through the coming months. So we really look forward to your feedback on that. Just thinking about our experience in Measure Accurately, 4 out of 6 was our approach, because we thought that it represented a significant commitment to that pillar, but also left some room for differences in organizational capacity and resources. And so that's the foundation from which we're starting. It is likely we would be consistent with that, but I think it's premature to say that. So appreciate the question. We do know, and we want you to focus on the evidence supporting each of those pillars and its direct tie to the guideline. Really, we would want you to strive to do all of those things from the standpoint of, having it being driven by quality improvement and evidence-based care. Anything else that you want to emphasize, Liz, before we wrap up, or other questions that I may have overlooked?
There's one question that I believe you answered, but they were asking about if we'll accept home readings to meet specific goals, or does the measure need to be taken in a clinic? And I thought that might be helpful to speak to.
Yeah, so if you're using blood pressure measurement data to calculate your control rate, there is an allowance for using home or in-office readings. If we were talking about either the SMBP pillar or the treatment or the Act Rapidly pillar, those references are about what you're putting in policy and what you're putting in practice. And so there's a flexibility there that we can address in our follow-up. So I'll want to reread that question to provide an even clearer answer, but thank you for that.
Thank you, Allison. I'm not seeing any new questions outside of one. I think we'll need to answer and follow up due to the complexity. But with that, I just want to thank everyone for joining us today and throughout this ongoing Target BP journey, for your continued support of your community and your patients in hypertension control. And we look forward to receiving your feedback, your questions. The survey is going to be the best way to communicate with us, but we will be offering many opportunities for office hours to support you throughout the data submission period, and FAQs to support the do you mean this or do you mean that? All of that is yet to come. We just wanted to share this exciting news with you right now, and are very appreciative of your walking with us down this roadmap.
Thank you, Liz. I really thank you for those reflections. We are very excited, and I mean it, that we come to the table with tools and resources and expertise of the AHA and AMA, but that is brought to life through your work. And we also continue to learn from you and want to understand your needs so that we can support your success going forward. So thank you, all of you, for joining us today. And we look forward to your survey responses and many more conversations to come on this quality improvement journey. Thank you so much.
Great rest of your day.